Hello, everyone. We are at the top of the hour, so we are going to go ahead and get started. This is Leslie Humble, the Senior Director of Marketing and Communications for Cure SMA. Welcome, and thank you so much for joining us today for our latest COVID-19 SMA community webinar. We are excited to see that some questions were submitted in advance of this webinar, and we are going to work to answer as many of these questions as possible during the presentation. We will also have a couple of questions at the end, and we will review those at the end of the call after the presentation. I would like to now pass over the discussion to Kenneth Hobby, President of Cure SMA.
Thank you, and thank you everybody for joining us here today. This is going to be our update on the current situation of COVID and how we see it affecting the SMA community, but we're also going to touch on a few additional topics of just other news and activities that are going on in SMA as well during the last part of the webinar here today. We do have an awful lot of slides and information that we're going to try and get through today, and so we did want to let people know up front, we might even skip some slides, go through very quickly on some topics, but there's a lot of important information. And so there is going to be a recording of this webinar. The slides and even some of the documents that we have in here are going to be available online afterwards. So please don't worry if you miss something. We'll make sure it's available online a little bit later on. And so if we want to go to the next slide. Just to start off with, what I think I did want to say is you will see throughout this some of the same topics and recommendations, guidance that we've been giving over the last 6 months or so. And that in itself might be a little frustrating, and just the situation as a whole, we know is going to be frustrating here because we're getting into a period where we're going to have to carry out some of the same procedures and isolation protocols that a lot of people in the community have been doing for a very long time. And that frustration we know is building for everybody on having to maintain this approach. And that is what's going to be important going forward, maintaining a lot of the procedures that we've been doing for the last 6-9 months of the pandemic. But as well, we know for the SMA community, there's a lot of lockdown normally because of the flu season, even going into kind of last year. So this has been going on for a long time. And I think the message you'll hear from us right now is that this is going to continue as well for quite a few more months as we go through the next season that's coming up, the normal flu virus winter season. And we're just going to have to maintain the approach that we've been doing for so long already. I think the message as well, though, is the approach is working. It is keeping us safe from COVID. We're being able to stay healthy from SMA. The approach has been working. It's going to be very frustrating, just the monotony of doing this over and over for so long, but we have to keep at it. And then again, the message that you'll hear at the end is also the work that we've had going on in SMA is still progressing very well. We're making great progress on all of the projects and work that we have going on in spite of COVID. And so what we're saying we're coming into now with COVID is technically kind of a third wave. Is kind of what people were predicting as what would be a normal second wave as you get into the winter months, the normal flu virus season. That's what we're hitting now. And you'll see in some of the charts, and I'm sure a lot of you see it, about the third wave that we're going into now with COVID. And it really is kind of escalating at quite a high level. And that's why we've got to be very careful in SMA. We've said this all along, and we're saying it very now as well, that for SMA patients, people living with SMA, COVID, getting actually infected by COVID could be a very bad situation. And that's why we're so forceful on our recommendations of keeping isolated, keeping all those protocols that we know how to do, keeping them going while the pandemic itself is at such a high level and increasing as well right now. I think there's some questions that we've seen, and we're wondering as well on this about the flu season, how that's going to play out with COVID, probably getting worse in the winter months. But the normal virus flu season that comes in as well, how is that going to be this year? I don't think anybody knows for sure. There could be two pathways. It could be that these isolation protocols mean that the flu season is a little bit lower than normal, but there's also maybe the angle of people not going for flu vaccine, regular checkups that might have an effect on not kind of keeping the flu season down. So we've got to watch that. I think as well, nobody really knows what would happen with flu and COVID at the same time. And that's a big unknown to be very careful on. Our big themes have been keeping safe from COVID. That's why we're doing these isolation protocols. We want to keep people with SMA, close family connections, safe from COVID because it could be so bad getting impacted there for somebody with SMA. We think this is going to now continue, and our recommendations are through the winter period. we don't think we're going to be able to have kind of a really kind of change in our procedures until we get a vaccine that's available, not just approved, but available for SMA patients and families. And that's not likely until next year at some point. So we've got to make it through these next winter months. We'll probably come back sometime in January, February, but for expectations, we see this going all the way through at least until March, April, that we're going to have to follow these protocols. The second theme that we've had is staying healthy from COVID, but the second theme is more staying healthy with SMA as well. The COVID's bad, we've got to protect against it, but SMA, the treatments are so important to keep on top of and keep those going even while dealing with COVID. And so that's been a theme as well, making sure that we're staying on treatments. Little delays here or there, we've said this before, a few weeks are okay, but these treatments are so important, more important to stay on those treatments, try and stay on time than the full isolation from COVID. Care and trials are important as well. We've got to maintain care. We've got to try and keep the trials that we have in progress going forward, but a little more flexibility there, especially looking for kind of telehealth medicine approaches for care and trials as well to bring those in. The big theme I think today that we're going to go through is keeping these going, safe from COVID, healthy with SMA, but paying attention, especially as this whole process now drags on for such a long period of time, paying attention to the social aspects of interaction, social isolation, emotional and mental health as well, issues, what we need to pay attention to there, resources that we're going to try and bring in to be available for the community. So if we go to the next slide, just to show a little bit on where we see kind of the COVID current situation, and some of these slides I'm sure are familiar to a lot of people, but the part on the left is showing the first, second, and now this increasing third wave that we look to be in right now. And it is already at a higher level than that second peak. And again, we are going into what everybody's predicted as the bad winter virus months. And so it could be going higher than where it even is now at this peak, the highest that it's been so far. The chart on the right looks at the whole US and particular states, and I think there's some items that we look at here which are important to pay attention to. And one is, it seems that it's a lot of the northern, colder states that are already kind of going into the fall and winter months that are starting to get highly affected right now. That's kind of the predicted sign that is kind of coming from the north down in the US, winter months, winter states first, and that seems to be the case. Not so much really escalating too much, definitely increases, but not at such a high level in the south. And I think what is probably concerning to us when we look at this map is it's definitely very widespread right now. It's not just a few pockets, 1 or 2 states that are accounting for a lot of the infections. It's very widespread. But also when you look at some of the very big states, especially in the south, California, Texas, Florida, a little bit on New York, these big states aren't yet being very much affected like the northern states. And so there's a chance here that this could escalate a lot more when the increases right now are coming from our smaller states, the less populated states. Some of these big states could start to catch up soon. And that's where you could see a really big increase coming over the next couple of months. So then the next slide. Our recommendations are right now to maintain the approach that we've all been taking over the last 6 to 9 months, and even into last winter flu season, maintaining the isolation protocols. What we are paying attention to, though, is just as important. The isolation is going to start to really bear down on people. And so looking for the virtual approaches, we're looking at what resources we can bring. We're hoping to get some of these out over the next couple of weeks to support work, school, social, mental health, the interactions, the community. That's going to be important through these next few months to keep us going. Again, on the vaccines, and we'll get to some more information on this, we don't have any final data yet to be able to say we have something, a recommendation from us for SMA patients and families on whether something works and is safe for somebody to take. We don't have that data yet. A lot of information says it could be coming soon, but the big angle to bear in mind also there is something might get approved. We even hope for a few. It's going to take quite a while for something to roll out and be available. I think a prediction that's out there for the general community is that it could even be to next year's flu season. Talking about 2021 and the fall, winter there, where a vaccine could be available for the general population. We're certainly hoping, and we're doing a lot of advocacy right now to push for SMA patients and families, caregivers, to be in the front lines and be a priority group. And again, we don't know for sure, but hopefully that could come a little earlier. That I think is our best hope, that maybe more around March, April, something is maybe available, approved, and we can get SMA prioritized rather than waiting till later in 21. We will have new resources. We're maintaining a lot of resources, information sharing, community, social events that we've had going on, and additional ones that we'll hopefully roll out over the next couple of weeks, more now on this social, mental, emotional health side as well. And then we'll probably come back early next year. We think it won't be done with the winter flu season at that point, but we'll come back January, February to give an update on the overall situation and how we're doing. So the next few slides I'll go through pretty quickly. These were slides that came into us from the community surveys that the SMA community does and gives information on. Here, this slide, the direct impact of COVID, how many people in the community are actually getting diagnosed, being exposed to symptoms, and ultimately as well, what we really keep a close eye on, actually getting into the situation of being hospitalized with COVID. And so I think the overall message, and we wanted to share here from this information, this slide is from the first wave period, is that the SMA community has done very well, actually better than the general population on staying protected from COVID, not getting exposed, not getting symptoms and diagnosed. And that again is everybody doing really well with the isolation protocols. So it has worked, and we need to keep doing that. And ultimately as well, not just getting exposed, but the proportion of numbers of people in the SMA community getting into the situation of being hospitalized, very low indeed. And that's ultimately what we want to see from staying safe from COVID. The next slide is the same information in the second wave. And you can see a little more exposure, a few more people getting diagnosed with COVID, and this does build up over time as the infection rate goes up. But what was really good was what we saw in this second wave. And again, this isn't everybody, just a survey, a sample from the community. Nobody actually in the survey said that they were actually hospitalized from COVID. We do think there's a few people out there, just not in the survey. But here it said very low, people are staying safe. The approaches we're taking are working. The next slides were from the same survey, and the first one again from the first wave that we had out. This one is talking more about not directly getting affected by COVID, but how COVID was affecting the treatment and care approaches of SMA. And this is where we wanted to minimize that impact. We need to keep treatments and care going as much as possible. And I think what we point out is the second bar in here talked about how many people were affected with their treatments, on getting delays to current treatments because of COVID and affecting hospitals and things like that. And it was about 20%, which was certainly something we want to minimize, but it wasn't too bad, especially in the first wave, to see little delays, weeks here or there, but something we kept a close eye on. You can see a bigger impact in the two middle bars. It's kind of 40–50% people getting affected with physical therapy care appointments and things like that. And again, that's probably high. We want to watch that, but we are looking for flexibility and telehealth in those areas. So this was the first wave information that came from the community. The next slide was in the second wave. Pretty similar, again, 40–50% of care, physical therapy, those kind of appointments. A little drop down, which we liked, it's not big, but down in that second bar to about 17%, people having delays in accessing treatments. So the next slide, it's shifting gears a little bit, and we'll come back to this at the end, is talking about all the good progress that we still have going on in SMA in spite of what's happening with the pandemic and with COVID. And we're seeing good access to the treatments, those little delays, but overall things seem like they're working pretty well with still keeping access, increasing access to the treatments that we have out there. We have good information that's coming in now from real world evidence, not just the clinical trials, but what's happening out in the real world of people getting onto the treatments and how it's working. And we need more of that going forward. We'll cover that in other areas, but that progress shifting from this clinical information to real world information about how the treatments work and ultimately how care works is moving along very well. And that's going to be very important in the next phases of continued coverage from payers for treatments, information for us and for the community on choices and decisions that people are going to have to make as more options come on the table for us in SMA. Really good progress in the newborn screening front. We're getting close to 70% of newborn states screening for SMA, and all that happening even with COVID going on. We've had the third treatment for SMA approved a few months back. We'll give an update on how that's progressing at the end of the presentation here, but that's 3 that we have now. And then just yesterday was very satisfying, was a positive, early, an interim, but a positive result coming out from a clinical trial. And that's great as well to see that a clinical trial can still continue even with the impact of COVID on the healthcare system and isolation, that trial is able to successfully recruit, progress, and get results. And it's very exciting as well as it's the next stage that we've been looking at, where it's a combination trial. This is looking at a treatment that can work in combination with the therapies that we have now that work on the genetics and the nerves, a treatment that can also work on the muscles, something that we've been pushing for quite a while, planning for, and now a trial result is coming through and it's looking positive just at this early stage. And we're starting to think about 21. And it's a little early to, again, predict things. We need to see the vaccine side play out, but we're looking forward to things getting back, and especially the in-person activities that are so important for our community. We'll keep all this progress going on the research front, treatments, access to the approved treatments and care, real-world evidence going forward. That's going to continue, but we really do hope we'll be able to get the in-person community coming back as well soon. So with that, I'm going to turn over to Mary, who's going to dig much more into the medical side here, staying safe from COVID, but staying healthy. So Mary, do you want to take it?
Thank you, Kenneth. Yes, good afternoon, everyone. So as Kenneth said, this is the curve for COVID cases, new COVID cases in the U.S. per day. It appears that we're heading into a third wave, although, as everyone's reading online, there's discussions that we never really left the second wave and possibly not even the first wave. I'm going to talk about new information, safety in the holidays, a little bit more about the viral season, vaccine, and antibodies. Next slide, please. So what's new? One of the things that has been discussed more actively is how is COVID transmitted? We know that it is primarily by larger respiratory droplets, which are shared by person to person in close contact, typically within 6 feet. Those droplets land on you, get in your mouth, your nose, your eyes, and you become infected. Another way that COVID is transmitted is via aerosol or small particle transmission. These are much smaller particles that hang in the air for longer periods of time. Examples are being around people who are singing or performing who also are projecting large droplets, but when the large droplet falls out, there's aerosol. So just to be aware that that is another possible way that COVID is transmitted. Contaminated surface transmission seems to be less. We are not changing our recommendations, though. Continue to wipe down the frequently touched surfaces like doorknobs, light switches, cabinet handles. But it seems that that is much less when in comparison to the respiratory droplets. And a statement has also come out that it is rare for transmission to occur from animal to people. It has occurred, though, that people have seem to have given COVID to their pets. Next slide, please. So the challenges with COVID-19 are that there are a significant number of asymptomatic infected people. So people who don't have any symptoms but clearly can transmit this infection to others. This COVID-19 is also highly contagious. It's much more contagious than influenza. It does limited contact within 6 feet with an infected person without protection can result in infection. In addition, the signs and symptoms of COVID-19 are similar to influenza and other viruses that occur, especially during this winter season. What is unique, though, about COVID-19 is that there's a couple symptoms that seem to only occur with COVID-19, and that is the loss of taste and smell, which can take a long time to recover, can be weeks after one is no longer shedding the virus and no longer has other serious complications or symptoms. COVID toes, which is an inflammation of the blood vessels, also seems to be unique to COVID. Next slide. Thank you, everyone who responded to our second COVID-19 SMA survey. This was a follow-up survey to the first. This is data Kenneth reference some of the points here, I wanted to share a little bit more about this data. Data was collected between the end of July and last week, and people with SMA, caregivers, and family members responded. And what we saw, as Kenneth pointed out, is there's a little bit less frequency of SMA treatments being canceled or delayed. We went from 20% to 18%. Care delivery has changed in experiencing canceled or delayed appointments. Actually went up a little bit, 39% compared to 37% of those who responded. People seem to have more, are better able to access essential SMA-related services, for example, physical therapy. 41% reported having difficulty. Last time it was 50%. 28% of respondents reported losing their job or had their working hours reduced, compared to 34% with the last survey. There's still a significant financial impact, 59% reporting this time versus 66% with our last survey. As Kenneth pointed out, still a very low rate of those who were exposed to COVID who actually had COVID. We had 3% who actually were diagnosed with COVID, and 4% who reported being exposed to others with COVID. And from this reporting group, there were no hospitalizations. However, we are aware of others in the community who were hospitalized. Next slide. Additional information that we learned from the survey is that 43% are concerned about being diagnosed with COVID-19 or acquiring COVID-19, and 60% reported being concerned about a shortage of personal protective equipment. Next slide. This question asked whether people were able to obtain protective equipment, and 40% reported no. So this is an ongoing concern that we are trying to help address, and 60% reported that they were able to get it. Although in the last slide, people are concerned that that access may be diminishing, especially as we head into another wave that appears to be higher than the previous waves. Next slide. So the question I probably get asked most frequently, and thank you so much to everyone for sending your questions in advance, is what does COVID-19 infection look like in individuals with SMA? We are aware of a limited number of people with SMA who have had COVID-19, which we are very thankful about. Kudos to the community for continuing the isolation protocols that you have. The cases that have been reported that we are aware of, people don't know where they picked it up. So again, it just speaks to how contagious this virus is. But symptoms that were reported to us were congestion, increased secretions, fever that varied anywhere from a few hours to several days. There were intermittent reports of loss of the taste and smell. And again, we don't have enough experience to generalize. We do plan to send out another follow-up survey or make it available. Please help us continue to gather information when we release that next COVID-19 survey. This information is so helpful and helps to provide guidance not only to each other, but to everyone in the SMA community. Next slide. So what can you do? So there are 5 core behaviors, things that we can do to help keep ourselves safe. And those include the following: wearing a mask. Wear a mask whenever you leave your home. It should cover the nose as well as the mouth. And wear it when you're in places that you do not have control over. Avoid crowds. Choose to be outdoors rather than indoors whenever possible. Much better ventilation. If you walk into an environment where you're concerned about the ventilation, it would be best not to spend time there. Maintain physical distance, a minimum of 6 feet from, again, people you don't know, are not sure of, and wash hands. If soap and water are not available, use hand sanitizer. But these 5 things, if you can remember these will go a long way in keeping you safe during this winter season. Next slide. So winter 2021 specifically, Kenneth already mentioned it's so important to get the influenza vaccine. We know that influenza all by itself, even without COVID, causes deaths, and there's serious complications, and people die every year. Influenza tends to be more severe complications occur in the very young, so less than 5 years of age, and older, greater than 65. By getting the influenza vaccine, although not 100% perfect, it will decrease the potential for complications of having influenza and also decrease potential complications of having COVID-19 infection. Now, keep in mind that getting the influenza vaccine does not protect you from getting COVID-19. Symptoms of influenza and COVID-19 are very similar. If you develop symptoms suggestive of either, typically you want to go someplace where they can test you for both. So be in touch with your healthcare provider to discuss your symptoms and talk about the next plan of action. Other things that Ken mentioned, and I just want to underscore, is to continue to receive treatments on time. Those are so critically important to get the SMA treatments as they are scheduled. Healthcare provider clinics and hospitals have policies in place, protocols in place to mitigate the risk of going into those environments. Do telehealth medical visits when feasible, and also maintain good nutrition. It's really important to maintain good nutrition, stay healthy as best as you can during these especially trying times. I also want to underscore that children less than 2 years of age should be seen by their healthcare providers so that they can receive their immunizations on time. Young children receive a number of immunizations, and it's just important to maintain that protection as well. Next slide. So what are we going to do? We have a lot of major holidays coming up. Halloween, Thanksgiving, Christmas, New Year's. This will be a very difficult winter. We get it. And we are open to ideas and things that you can share. Please share with us. For the time being, use Zoom and FaceTime to connect with others. Again, avoid large gatherings, avoid large crowds. Continue to avoid others who are ill. Stay home. You also want to restrict your home to outsiders, with the exception of essential caregivers who you know and trust to be in your home and who are also very cognizant of their potential exposures when they're not in your home. Maintain all your previous isolation home protocols. If possible, use grocery and pharmacy delivery services. These are becoming more popular, maybe isn't the right word, but more and more large businesses are providing these services. Next slide. So as Kenneth said, we are cautiously optimistic about the coronavirus vaccine. Currently, there are 11 vaccine candidates that are in phase 3 clinical trials. 5 of the coronavirus vaccine clinical trials are in the U.S. These vaccines are made from coronavirus RNA, protein that's delivered via viral vector, whole and activated coronavirus. There is a whole variety of techniques that are being used to try to figure this out as quickly as possible. We do know that it will be given as an intramuscular shot. Early testing has been promising, and you've read the news reports about it. It increases people's antibody levels. Also, some of these trials have been paused to evaluate side effects that have occurred, and then they have resumed. Currently, there's no interim results available. We are reading that at least one company is planning to file in November. We'll see if that happens. The earliest we expect that a vaccine may be available is early next year, with rollout in the spring. Again, fingers crossed. We're being cautiously optimistic, but we have to be realistic and stay safe until a vaccine demonstrates efficacy in the general community. Next slide. Very briefly, antibody testing, we don't know what it means. We still don't understand this virus well enough to say whether antibodies are protective. We're reading and hearing about the potential of antibodies waning after several months. So I'm leaving this slide, go into the slide, and you can read more about what antibodies are and what it may mean, but we really are not sure that it's even useful at this point. Next slide. So if you have or have been exposed to COVID-19 and SMA, the general recommendations, and I encourage you to go to the cdc.gov website. They continuously update that information. It is good information. For yourself, isolate. You need to be in isolation if you develop COVID. Separate bedroom, separate bathroom, no shared common space. Wear a mask. If you need to move about where you're with other people, wash hands. And it's really important to stay hydrated, especially if you're running a fever. Drink extra fluids. If you're the caregiver of someone who has SMA, I would encourage as much protection as possible, including you would wear a mask for sure, consider getting a face shield, gloves, wear a cover gown or an extra layer of clothes that you can take off and leave just outside the room of the individual who has SMA. Don't eat together. Continue to clean the high-touch surfaces daily, and above all, implement the illness plan that you have developed with your healthcare team. It's very important to use the tools that you have available. It is a viral illness. It will induce weakness in people who already have underlying motor weakness, and it will result in increased fatigue. Keep in mind that there is no approved medication to prevent or treat COVID-19 infection at home. If hospitalized with severe infection, remdesivir was approved by the FDA. If ventilation is required, they will also add dexamethasone. And please, please call your healthcare team if you develop symptoms, if you have specific questions related to COVID. If you're not sure if you have influenza or COVID, you want to be tested for both. Next slide. So I just want to remind people when to stop isolation following a positive test. And again, there are people who are going to have positive tests even though they're asymptomatic. So for those who are symptomatic, it's at least 10 days since the symptoms start, and 24 hours after the last fever without fever-reducing meds and symptoms are improved. If someone has severe illness, it may take much, much longer for them to be able to come out of an isolation situation. If you have no symptoms and you're positive, you can stop isolation after 10 days from the first positive test, and consider being retested in consultation with your healthcare provider. Next slide. So I want to remind people too that we have the Cure SMA COVID-19 resource web pages. You go to our home page and it's right there. Just click on the link and it'll take you to additional information. I now want to turn the program over to Colleen McCarthy-O'Toole. Thank you.
Thanks so much, Mary. We can go ahead and go to the next slide. Hi, everyone. I just wanted to go over quickly a few of our support programs that we have available. The first one I wanted to talk about is our COVID-19 support package. So we launched this package in April and we do still have it available and wanted to make sure that everybody knew that we still had it available. It's a package that includes things like antibacterial wipes, antibacterial gel, tissues, lotion. There's even some activity books to help keep people active and busy. So if you would like one, just go ahead and contact Cure SMA. There's a link on the slide that shows you how to request one as well, but they are still available. Next slide. We are still offering our Summit of Strength webinars, and they're going really well. Attendance has been great. They're most Wednesdays, and we have different topics every time, and they've been really going really well, and people really enjoy them. November 4th, we have Mary Schroth giving a topic of SMA pulmonary standard of care and anticipating the viral season. On November 11th, we have Dr. Al Friedman presenting supporting siblings and SMA-affected families. And on November 18th, we have Projected Tomorrows, which is a financial planning webinar. So if you're interested, please attend those. You can register for those and get information on our website. Next slide, please. We are offering virtual family socials, which is something that is sponsored by Novartis Gene Therapies. And these are Zoom family socials that are really fun. People are really enjoying them. We have one coming up on Wednesday, November 18th, and they're available for families all throughout the US. And we're going to mix all states this social, so people are really excited about it. So if you're interested in registering, please contact the Family Support Department at Cure SMA. Next slide. We also wanted to go over some programs sponsored by Biogen. We have our virtual Adults with SMA Socials, which are also Zoom socials. They've been going really well. It's a great way to connect with other people. Our next Adults with SMA Social is going to be on Tuesday, November 10th. Again, there's registration information on our website if you're interested. Next slide. We're also announcing, I'm very excited about these two new events going on for adults with SMA. The first one is Adults with SMA Virtual Trivia Night, which is a pub style trivia night we're going to be offering. The first one is going to be on Thursday, November 19th. We're really excited about it. Sounds like it's going to be a lot of fun. If you have questions, definitely email Family Support Department, but registration is just live now for that. We are also announcing something that we're really excited about, an Adults with SMA Virtual Book Club. And registration information on that is coming soon, but keep your eyes out for that. That's going to be something very exciting. Next slide. The Medical Alert Bracelet program is something sponsored by Genentech. This is a new program we just launched this summer. It's also been going really well, and they are still available. It's for anybody that lives in the US that has a confirmed SMA diagnosis. So if you're interested in receiving one of these bracelets, contact the Family Support Department or go to the link that's on the slide, and you can fill out a request form for it. And next slide. Now I'm going to go ahead and turn this over to Maynard Fries, who's the Vice President of Advocacy.
Great, thanks, Colleen. Next slide, please. So on advocacy, our work has focused mostly in two areas as highlighted on this slide. First, we've been educating stakeholders on the needs of the SMA community as it relates to this public health emergency. We've written to Congress and state leaders, including Medicaid directors, about the needs of individuals with SMA and their families. We've focused especially on ensuring access to care and services during the pandemic. Second, we've been closely monitoring legislative and administrative actions, watching especially for impacts on and opportunities for the SMA community. For a summary of our recent advocacy actions, you can visit the Cure SMA COVID-19 information page on our website. Next slide, please. Our most current advocacy has been focused on COVID-19 vaccines. We've been pushing for priority access to vaccines for the SMA community. There are two national committees that are looking into how to responsibly and fairly distribute a COVID-19 vaccine. The first is known as the Advisory Committee on Immunization Practices. This is an existing federal committee that is managed by the CDC. The second national committee is new. It was created through the Operation Warp Speed initiative, specifically to focus in on COVID-19 vaccines. This group is called the Committee on the Equitable Allocation of Vaccine for the Novel Coronavirus. Definitely a mouthful. This group is managed by the National Academies of Sciences, Engineering, and Medicine. Recently, Cure SMA has provided statements and testimony to both of these committees. Our goal is to educate them on SMA, the health complications associated with SMA, and to highlight the impact COVID-19 is having on the SMA community. Thank you again to those of you who shared that feedback with us through our past COVID-19 surveys. The CDC committee is meeting this week to hear updates on and to discuss the COVID-19 vaccine development and allocation. We'll be watching for more information about that. Next slide, please. Earlier this month, on October 2nd, the Operation Warp Speed Committee released recommendations for distributing COVID-19 vaccines in a major framework paper. The committee proposes 4 very broad distribution phases. Generally, individuals with rare diseases would fall under the second proposed phase. Healthcare workers and older adults who live in congregate settings, for example, fall into the next phase, or the first phase, excuse me, under this proposal. Next slide, please. So this slide just shows that the committee acknowledged Cure SMA's public testimony on page 213 of that report. They highlight the fact that we did submit testimony and we had asked for that Cure SMA and SMA community is considered a priority population within that document. Next slide, please. Regarding these recommendations, we expect the CDC committee to formally vote on and approve recommendations at a future meeting once a vaccine has been approved. In the meantime, state and local public health agencies are being asked to prepare for a possible vaccine. Given the important role local health agencies and providers play in distribution, Cure SMA recently wrote to all 50 governors asking that they consider priority access for the SMA community within their states. Cure SMA will continue to look for ways to advocate for the SMA community on all issues related to COVID. That concludes my presentation. I will now turn it over to Kenneth for the next section of our webinar.
And I think Maynard, you're staying on, we're having Mary come back as well. And so this is just shifting gears a little bit now, where we're not going to talk about COVID, but the other activities that we have going on in SMA, and actually what we think is still the really good progress and results in spite of COVID. And that's kind of a highlight for the strength of our community. So we'll talk at a very high level just about access to current treatments, how that's progressing, new treatments, and even this new exciting early clinical trial result that came out. And so the next slide, I think Maynard, is just for you to highlight a few of the advocacy efforts related to access for current treatments.
Great, thanks, Kenneth. So in addition to what we're doing related to COVID, Cure SMA has been very active in promoting access to available SMA treatments for all individuals with SMA. Since we last got together, the FDA approved Evrysdi, the newest SMA treatment, as has been mentioned before. That approval date was on August 7th. Just a few days later, Cure SMA mailed and emailed letters to insurers across the country urging full coverage to match the FDA label. Our Evrysdi outreach included letters to major regional private payers, state Medicaid agencies, and all governors across the country. As you'll hear later, our outreach is already resulting in coverage policies for Evrysdi. Cure SMA's outreach and education is ongoing and comprehensive, covering all 3 SMA treatments. It's a major part of what we do each and every day. Our goal remains the same: to push insurers to cover Spinraza, Zolgensma, and Evrysdi to match their FDA labels. Our ongoing outreach falls into 2 major areas. 1, we conduct targeted outreach for policies with major restrictions. 2, we provide general updates when there is new data or real-world evidence that emerges. Our coverage outreach has been especially active in the last 9 months, even during the pandemic. Since March 2020, we have initiated more than 200 direct communications with public and private payers. Many of them, especially in the last couple of months, have been one-on-one outreach where we are responding to a very specific policy or a proposed action. This outreach can occur through a letter, a written public statement, or showing up virtually and testifying at an open meeting. We know how important it is to access treatments, and so this work continues for all 3 approved treatments. Now that I have summarized our outreach, let me turn it over to Mary, who will discuss the important work her team does in tracking and analyzing available SMA policies.
And I'll add a quick first, though, just to say for these next 3 slides, if you do want to go to the next slide, this is where there's a lot of information. We're going to have this available online later, and actually the documents themselves. This is kind of a visual that we're trying to show, where for each specific treatment, we're tracking all of the insurers that have a policy out there. And this is for Spinraza. You can see there's a lot. Each row is a commercial or a Medicaid policy that we have out there. And then each cell going left to right is where we're tracking the characteristics of SMA age and type. And what we want to see is this matching to the FDA label. And so green is good. It matches for that particular type or age. The policy is covering for that characteristic on what's in the FDA label. So we want the green. It's kind of a visual. The reds are the restrictions that we don't want. We're looking for kind of majority to be green. We're never going to quite get there, but this lets us track as well and push back on payers where there's a restriction, where there's a red. So it's kind of a visual, a takeaway. We'll have these online. here, especially for Spinraza, you can see it builds up over time. We've got an awful lot of policies out there, and it's looking pretty good, mostly green, still pushing, and we need real world evidence to keep pushing now instead of just clinical on those restrictions, but here it's looking good. So Mary, do you want to go through the three?
Yes, thank you. So this is our 4 years, almost 4 years of experience with Spinraza. So just know that the policies are never set in stone. They may be set in stone for a period of time, but they are regularly reviewed. And if additional information is submitted to payers, they may revise their policy. So it's just so important to provide feedback to payers to alter their policies so that they do match the FDA label. So for Spinraza, FDA labels all ages, all copy numbers, all types, and we're seeing that it's very good coverage for types 1, 2, and 3, and SMN copy numbers 2, 3, and 4 in pediatric patients. Non-invasive ventilation, also good coverage. Where it's restrictive are adults, SMA type 0 and 4, having only one SMN2 copy number, and having a trach. Next slide. This is our experience with Zolgensma, which was approved in May of 2019. FDA label is less than 2 years of age, all copy numbers, all types. You can see that's what we're seeing is very good coverage for SMA type 1, SMN2 copy numbers of 1 and or 2, if they've received prior Spinraza treatment. And up to 2 years of age. We initially had some difficulties with some policies restricting to 6 months of age, but we've successfully helped move that needle. Restrictive are SMN2 copy numbers of 4 or more, and advanced SMA. Next slide. So Evrysdi has been available for almost 3 months. And already we're seeing lots of activity and published policies. It's gone much faster than our previous experience. So FDA label is greater than 2 months of age, all types, all copy numbers. And we're seeing very good uptake for SMA type 1, 2, and 3, SMN2 copy numbers of 2, 3, or 4, being on BiPAP, both pediatric and adult, having prior Spinraza treatment, and ambulatory. We're seeing good uptake for one SMN2 copy number and having a trach. And it's much more restrictive. Many more policies are restrictive on SMA type 0 or 4, being previously treated with Zolgensma, and they're restricting use of Spinraza and Evrysdi at the same time. Next slide.
And so this next slide, it's a little bit beyond just kind of the insurers, the payers part, just a little bit of a general update on what we're seeing with Evrysdi, where we're just a few months in following approval. And I think just to highlight a few aspects, and we'll certainly come back as more information comes out and we get further along. But basically what we're seeing is that we're having good numbers that are getting approved. It's a few hundred that have got approval and are getting on treatment. Short period of time here, just a few months where it's been available. Not just the numbers though, I think more than anything else, what we're pleased to see is the breadth of the characteristics of people with SMA who are getting approved. That's very important, that it's broad. The numbers are, we'll watch that over time, but we've seen really good on the types. All types are getting approved and access. We're seeing very broad on the ages, even from I think about 3 months all the way up to about 60, 70 years of age getting approved and getting access. That's really good. One thing in particular really stands out, which is that in the SMA community, we're 50-50, with 50% over 18, 50% under 18. And actually for the people, the approvals that are coming for Evrysdi, it matches that exactly, which means we've got that really good balance, which is what the community is, with half over and half under 18. That's the same kind of proportions getting approved for Evrysdi. So we want to see that and that breadth, again, in the ages, but the kind of the balance on the proportions. What I think we're seeing is policies starting to come out very early. It's actually good to see these getting put out publicly and getting written. That takes a while for payers to work through that process. So we're seeing them come out. The message though to go with this is, it is very early, that if you don't see a policy out there for your payer, that doesn't mean don't move forward. You can still get approved, you often will, even if there isn't a policy publicly available. You can still apply, get approved. we would encourage you to do that as well. You help set the precedent. That process actually helps get the policies in place and get coverage defined for other people that come into that same payer later on. So don't hold back if you don't see a policy. Don't get discouraged if you see a restriction on a policy that's out there. Again, this is a process that we expand over time. You going through that process actually helps. Don't get discouraged if you get a denial. That's kind of par for the course when something first gets out. We've seen that before. Go through the process. And especially in all these cases, reach out to us, let us know what your experience is. If you're having trouble, if you're getting a denial, we can get involved with our advocacy to help you, but also kind of work directly with the payer. So please let us know as you go through those steps. Mary, is there anything you wanted to add?
No, you covered it, but I just want to underscore that it's just so important for those prior authorization requests to be submitted, because those do trigger policy review and policy development if an organization, a payer, does not have a policy in place. So yeah, don't let that hold you back. And as Kenneth said, use that opportunity if you receive a denial to follow their instructions and use it to educate the payer about SMA and new treatments. Sometimes we're finding that there's a misunderstanding or misinterpretation of some of the information that's available. And I know when we've been on the public testimony, the drug utilization review committees, we're learning about what some of those misunderstandings are, and that just helps guide us to create stronger statements. So I will turn it back to you, Kenneth. Thank you.
Thanks. Yeah, the next slide is now, those are the treatments. This is talking about a nice result that came through just yesterday on clinical trials. The progress still going on there. And so we'll definitely have much more information. This is just one slide, high level, to show some good progress. This is from a middle phase 2 clinical trial. Early result, even it's an interim result on that phase 2 trial. It hasn't completed yet, but it's a good positive result to see at this point in time. No guarantees from this point on what the next steps would be. Not everything works, even with a positive interim, positive phase 2 result, but we like what we're actually seeing on this one. And I think there's some things that stand out. So this is a different kind of treatment. This isn't the treatments that we have now, which are focused on the genetics, SMN1, SMN2. Those are focused on the genetics that cause SMA, focused on kind of maintaining the nerve cells, which is the critical step. But what we need in SMA is the combination where we have treatments that work at that level very powerfully. But we know to build up strength as well, we need, and we've talked about this before, you need care, you need physical therapy, nutrition to help build up muscles, bring back strength. There's also opportunities to have treatments and drugs that can do that as well. And that's what this particular treatment is. It's focused on the muscles to help build up that strength, but in combination with these very powerful genetic nerve treatments. So this is one of these first drugs moving forward. It's done as a combination trial, which is actually very difficult and complicated to do in any disease. These trials get very difficult to pull off. And so that's a great sign we've been able to do this interim, but been able to do this with COVID going on. And again, it's very exciting that this is the combination of the two very different approaches to attack SMA working together. Spinraza mostly here, and this new treatment working in combination. And we'll come back, probably we could do another webinar and drill into the results, but seeing some very positive additive effects, the two drugs working together, giving very good increases in the measurements, the scales that we do in these clinical trials to show whether there's an improvement, whether something's getting better. So very interesting, very positive at this point, and really positive for us to see the SMA community pulling this off with COVID going on. And so I think with that, we're going to turn back to COVID a little bit, and we've got a few questions we're going to try and squeeze in before the top of the hour. And Leslie, do you want to take those?
Sure. Thank you, everyone. We're now going to answer a few questions that were submitted in advance of the webinar. We hope that most of your questions were answered as part of the presentation, but we're going to walk through a couple of questions that touch on some additional topics. So the first question is, does zinc, vitamin C, and D help prevent COVID or help you if you get sick with COVID? I'll send that one over to Dr. Schroep.
Thank you for that question. There is evidence that vitamin D deficiency or low vitamin D levels is associated with more severe COVID-19 infection and possibly viral infections as well. If you live in a cooler climate, such as for Chicago, for example, or spend limited time outside, please check with your healthcare provider about recommendations for vitamin D supplementation. Vitamin C and zinc, there's mixed evidence supporting them. It's really all about getting a healthy diet. If you choose to take supplements, please discuss them with your healthcare provider and stay safe in your choices. Thank you.
Great. The next question is something we touched on our last call, but we did get some questions about this. With children with SMA and or their siblings possibly going back to school, what are some of the best practices to protect our child with SMA?
One thing I'd say up front just to start is, the last time that we did this webinar and we said, maybe watch for the first 2 months before having children with SMA or siblings go back to school. We were kind of saying last time on our last webinar on COVID, stay isolated. It's probably not the time to go back to school, even for siblings. I think we're hoping things were going to get better on COVID and that would have opened up those opportunities, but it obviously hasn't. And I think our same approach is going to it's going to be the same here with COVID now looking like it's getting worse, third wave. People have to stay isolated. People with SMA, close family, siblings. It's very difficult, we know that, but really going into this tough period right now, I think that isolation's got to continue on. Mary, do you want to add?
No, yes and no. Yes, I totally agree. We need to maintain isolation, especially as we're going into what appears to be a greater surge of COVID infections across the country. My commentary to this community, though, is that schools are doing their best to mitigate the risk of attending school with policies and procedures, but we're also seeing that they're changing every day, every week. Schools that are open are closed. Schools that were closed are open. There's a lot. It's just very dynamic. And for the SMA community, truly what is safest is just to stay home, do the virtual education. It's just very hard to, I think, deal with that risk mitigation in the current circumstances. Can you hear me?
Yeah, you're still on.
Yeah.
Okay, good. Sorry about that.
Great. The last question we had is around clinic appointments. Should we resume therapies in a clinic setting, especially if we see that our child is regressing due to the use of teletherapy?
Please contact your healthcare team and discuss options. It really is all about balancing risks and looking at your local health department about, what is the state of COVID in your community. This is really an active conversation between your healthcare team and what your options may be. Healthcare facilities are doing their best. They have protocols in place, but there's still a risk. Every time you leave your home, every time you go see someone that you don't know well. So there's no easy answer here. And we're going to be offering, and maybe that's what you're going to say, Kenneth. Our plan is to offer some physical therapy webinars in the near future to try to help. It won't replace having in-person therapy, but maybe provide you with additional guidance.
And I was just add that I think here, it is talking about physical therapy, those kind of visits, the care visits. Just to reiterate, it's not being talked about here, but treatments, the recommendation is no, you should still be going in to get the treatment, access to those. Again, a few weeks here or there, delay is needed to work around schedules, but those shouldn't be getting put off for any long period of time, the actual treatments themselves, as compared to physical therapy visits.
Great, thank you both. We would like to thank everybody who participated and listened to today's webinar. We'd also like to thank our sponsors, Biogen, Genentech, and Novartis Gene Therapies for their ongoing support of our COVID and community support programs and activities. Please know that Cure SMA is here if you have any additional questions or needs, and if there is anything that we can do or you have additional questions, you can email us at info@curesma.org. So thank you, and everyone have a wonderful day.
Thank you.